And this is not just because they are both a consequence of ageing. Evidence has shown that osteoporosis, or low bone density, is associated with fatty accumulation in blood vessels. With time, these become calcified, which is the deposition of calcium in arteries in a process known as calcification. Now, calcification hardens blood vessels and fundamentally changes their elastic properties. We term this an increase in arterial stiffness. One simple way to think of this is a rubber band. In a flaccid band, if we strike it with our fingers, waves will move along relatively slowly. However, if we stretch that band out until it is stiff and strike it once again, waves will move along a lot faster. Similarly, every time your heart pumps out blood, waves of pressure are sent out along with it. In stiff and calcified blood vessels, this wave returns to the heart a lot faster than it would normally, creating an overload, meaning the heart has to work overtime in order to compensate. And this has serious clinical implications. Given Australia's ageing population, diseases and conditions which affect older people are likely to massively increase the economic costs of care. Already, cardiovascular disease is the biggest cause of death, and osteoporotic fractures cost over $30 billion annually to treat. It is therefore imperative to develop simple, safe, clinically effective and cost-effective primary prevention strategies. And so my research interest is in using lifestyle interventions to treat age-related conditions. Specifically, my PhD will investigate the potential benefit of a combined exercise and vitamin D intervention in a randomised controlled clinical trial to improve low bone mass and increased arterial stiffness in older people. Exercise has been shown to effectively improve these outcomes. Further, low vitamin D has been observed in people with either low bone mass or increased arterial stiffness. So therefore, by combining exercise with vitamin D, we may gain an additional benefit from the two-hit therapeutic strategy. We hypothesize that vitamin D will potentiate the beneficial effects of exercise. And so, in a sense, by addressing multiple risk factors, we are stretching the benefits of our single therapeutic strategy. And this is an attractive approach because this simple strategy can then be deployed to the wider population to combat and limit the progression of adverse health outcomes related to poor vascular health, such as heart attacks, and poor bone health, such as fractures, and overall improve the quality of life in older people. Thanks for your time.